So the Public Health Levy on alcohol is also known sometimes as the Public Health Supplement and sometimes as the Alcohol Harm Prevention Levy. And it's essentially a tax on businesses that sell alcohol. So it's a tax that would apply to certain retailers that sell alcohol and make a profit from alcohol. And the idea is that the businesses that are profiting from alcohol should also contribute to addressing the cost of alcohol harm to society. So there's a few different ways that the levy could work. The Scottish Government actually previously had a public health supplement in place for a couple of years prior to 2014. And the way that that one worked was that it was an additional rate on non-domestic business rates, which is basically a fancy way of talking about, I suppose, the equivalent of council tax that businesses pay. So the way it worked before is that there was an additional charge put onto that business rate that they pay, and it was 13 pence for every pound of their domestic business rate. It was charged to businesses of a particular size. So at that time it was businesses that sold both alcohol and tobacco, but it was only large businesses that sold alcohol and tobacco. So in practice it pretty much applied to supermarkets, big supermarkets and off sales that were selling alcohol and tobacco together. So it is a charge applied to businesses that they pay as a tax, so the money comes into government. And the idea is that the businesses that are making money off of health harming products pay back into the government to offset the cost that the government has to pay to meet the costs of alcohol harm across society. There are other ways that it could work, and at the moment what the Scottish Government has committed to doing is revisiting the previous public health supplement model. We as an organisation are not wedded to that particular model as long as there is a supplement or a harm prevention levy, a levy of some kind that seeks to claw back some of the profit that businesses are making from alcohol. So we're experiencing an alcohol harm crisis in Scotland at the moment. It's been described as a public health emergency. So we have seen a 25% increase in the number of people dying each year due to alcohol, and we're seeing rising levels of alcohol harm. That harm costs society a significant amount of money. It's estimated that alcohol harm costs Scotland at the moment approximately £10 billion per year, 700 million of which is in health care costs alone. And I think we've all experienced and are aware of the pressure that the NHS is under at the moment due to cost of living crisis, restrictions on budgets, and still dealing with the after effects of the pandemic. So we know that while we're all bearing the cost of the alcohol harm, alcohol producers and retailers are still making a significant profit from selling that product. So this call for the need for a levy or a supplement to claw back some of that money is based on something called the polluter pays principle, where a business that is polluting or contributing to harm is required to pay something back to try and mitigate the effects of that harm. Coupled with that, we know that the squeezed budgets within NHS and local authority are having an effect on the availability of alcohol treatment services. So we know that over time, due to austerity, there's been a reduction generally in health and social care services and the availability of those services. But with alcohol specialist support in particular, we've seen a really big reduction in the number of people being able to access specialist alcohol treatment over the last 10 years. So across Scotland, the number of people accessing that support has decreased by about 40%. So the money coming back into the system from the levy or the supplement, we're arguing that that should be reinvested in specialist alcohol treatment and support, invested in recovery communities, and invested in preventative action to help people avoid reaching that point with their alcohol consumption where they start to need support services. So it's about trying to ensure that any profit that's being made from alcohol, at least some of it, is being reinvested into support services for people that need help. So at the moment, probably the best way to have your views heard is to engage with organisations like Alcohol Focus Scotland, to speak to our involvement and engagement team so that we can capture your views and feed those into the advocacy work that we do with Scottish Government and with local authorities and other partners. Scottish Government have committed in their budget to revisiting the previous model of the public health supplement that they had, so we know that it's something that they're interested in looking at, but where they go with that at the moment, we're not sure. Our job as a public health advocacy organisation is to promote the voices of people who would be affected by certain policies, including policies like this. So that's why we're coming out to talk to recovery communities and other communities to seek your views so that we can make sure your voices are heard on this issue. We're particularly interested in talking to people about where they would like to see the money raised by a levy being invested. We want to understand what people would like to see in terms of treatment services, support services, recovery, because we're being asked to answer that question by policymakers and politicians. If we were to raise this amount of money from taxing people who sell alcohol, how would you want to see that money being spent? So any views that anyone has around that would be really helpful for us to hear. You can also speak directly to your own politicians, your MSP, your local councillors, to make them aware of the need for this levy. And hopefully we'll see some consultation taking place by the Scottish Government that we can support people to engage with as well, if and when that comes about.